Now, I want us to think about how we're nurses. This is probably a little easier. You probably thought of yourself as a nurse in some ways in your caregiving role. I'll tell you, it was never on my radar to be a nurse. I don't really like all the blood and stuff. And so it was shocking. It was shocking to me as a caregiver how many things I did that I didn't necessarily feel qualified to do. And, from medication management, it's a big responsibility to make sure that medications are given appropriately. My dad had an Exelon patch, and one of the side effects what had been sudden death for people that had more than one patch left on them. It's a slowly released drug, but if there's too much in the system, it had caused obviously a side effect none of us want. And so those responsibilities are so important. And nurses they have such a wide variety of knowledge base, but I'm amazed over and over again as I talk to caregivers of all the things that they are doing medically to care for their loved one. I have a young lady in a support group that I've been leading for the last 5 years who does things that even the home health aides are not allowed to do. She cares for her mom in so many amazing different ways, from managing blood sugar, knowing how to adjust the insulin levels, to actually helping with diuretics. It can be really, really uncomfortable to feel like you're having to make all these decisions. And so I'm amazed over and over again at how many things that we have to do in the realm of being a nurse for our loved one. I was so thankful for my sister, who actually was interested in the medical field when she was younger, and things like wound care did not scare her. My dad had melanoma and had a large spot taken off, and when they do that surgery, they go all the way down to the muscle to be able to make sure that they get clear margins. It was a very large hole in his shoulder, and they had a skin graft over the top of that. And sadly, 2 weeks after his surgery, his skin graft failed because he had MRSA in that wound. Oh my gosh, a whole new level of wound care. I was so thankful I had my sister. She changed the bandages. She documented how it was healing. She took care of so many things that I'm just thankful that wasn't something I had to do. Have a team, get that team together, because there are people who have different gifts and strengths. So definitely so important, I think, to understand in that nursing realm that and as a caregiving, you will be doing things that fall within those responsibilities. And again, I think education comes in there. If you're not comfortable, ask for help, ask for more training. My sister attended the wound clinic with my dad and learned all the things that she needed to do to be able to take care of his wound well. So make sure that you're asking those questions, but I guess don't be surprised when you're asked to do things that you never imagined that you would be doing, part of that caregiving role. And we're so thankful that you jump into that role and take care of your loved ones so well.